101. A patient with type 2 diabetes asks why exercise is important. What should the nurse explain? Answer. It improves insulin sensitivity and glucose control. Rationale. Exercise enhances muscle glucose uptake, reducing insulin resistance and helping maintain stable blood glucose levels. 102. A patient with diabetes has a blood glucose of 650 milligrams per deciliter and confusion. What should the nurse prepare for? Answer. Treatment for hyperglycemic hyperosmolar state, HHS. Rationale. Confusion and extreme hyperglycemia indicate HHS, requiring for fluids, insulin, and electrolyte management to stabilize. 103. A nurse is reviewing a patient's insulin pump. What should the nurse check regularly? Answer. Infusion site for redness or infection. Rationale. Pump sites can become infected or irritated, impairing insulin delivery, so regular inspection ensures effective therapy. 104. A patient with diabetes reports increased thirst and a blood glucose of 300 milligrams per deciliter. What should the nurse do? Answer. Administer insulin as prescribed and encourage hydration. Rationale. Polydipsia and hyperglycemia require insulin to lower glucose and fluids to correct dehydration caused by osmotic diuresis. 105. A nurse is teaching a patient about diabetic foot care. What should the patient do daily? Answer. Inspect feet for cuts, blisters, or redness. Rationale. Daily inspection detects early issues, preventing infections or ulcers, especially in patients with neuropathy. 106. A patient with type 1 diabetes has a blood glucose of 280 milligrams per deciliter before a workout. What should the nurse advise? Answer. Check ketones and consider delaying exercise. Rationale. Glucose above 250 milligrams per deciliter may indicate insulin deficiency, and ketones increase DKA risk during exercise, requiring caution. 107. A nurse is administering insulin to a patient with a blood glucose of 85 milligrams per deciliter. What should the nurse ensure? Answer. The patient eats soon after injection. Rationale. Insulin at a normal glucose level risks hypoglycemia if not followed by food, so meal timing is critical. 108. A patient with diabetes asks about low-carbohydrate diets. What should the nurse explain? Answer. They can help control glucose but need balance. Rationale. Low-carb diets reduce glucose spikes but require protein and fat balance to avoid hypoglycemia or nutritional deficiencies. 109. A patient with a blood glucose of 40 milligrams per deciliter is unresponsive. What should the nurse do first? Answer. Administer glucagon intramuscularly. Rationale. Severe hypoglycemia in an unresponsive patient requires glucagon to raise glucose, as oral carbohydrates are unsafe. 110. A nurse is teaching a patient about insulin pen needles. What ISS should the patient do with used needles? Answer. Dispose of them in a sharps container. Rationale. Used needles are biohazardous and must be disposed of safely in a sharps container to prevent injury or infection. 111. A patient with type 2 diabetes is prescribed exenatide. What should the nurse monitor for? Answer. Gastrointestinal side effects like nausea. Rationale. Exenatide, a GLP-1 agonist, commonly causes nausea or vomiting, especially initially, requiring monitoring for tolerance. 112. A patient with diabetes has a thick callus on their toe. What should the nurse advise? Answer. See a podiatrist for professional removal. Rationale. Calluses can hide ulcers or cause pressure injuries, requiring safe removal by a specialist to prevent complications. 113. A nurse is caring for a patient with DKA. What lab value indicates resolution? Answer. Closing anion gap. Rationale. A normalized anion gap indicates resolution of acidosis in DKA, reflecting restored metabolic balance after treatment. 114. A patient with diabetes asks about meditation. How does it help? Answer. It reduces stress and stabilizes glucose levels. Rationale. Stress raises glucose via cortisol. Meditation lowers stress, helping maintain better glucose control. 115. A nurse is teaching a patient about sick day management. What fluid should they drink if nauseated? Answer: clear liquids with carbohydrates like sports drinks. Rationale: clear liquids with carbohydrates maintain hydration and glucose levels during illness, preventing hypoglycemia or DKA. 116. A patient with type 1 diabetes reports unintentional weight loss. What should the nurse assess? Answer: blood glucose and ketone levels. Rationale: unexplained weight loss may indicate uncontrolled hyperglycemia or DKA, requiring glucose and ketone evaluation. 117. A nurse is preparing to administer insulin detamir. What is its primary function? Answer: provide basal insulin coverage. Rationale: detamir is a long-acting insulin, maintaining steady glucose control over 24 hours as a basal dose. 118. A patient with diabetes has a blood glucose of 95 milligrams per deciliter at bedtime. What should the nurse suggest? Answer: eat a small, balanced snack. Rationale: a bedtime snack with protein and carbohydrates prevents nocturnal hypoglycemia, especially with near-normal glucose. 119. A nurse is teaching a patient about continuous glucose monitors, CGMs. What should they check? Answer: sensor site for irritation or adhesion. Rationale: CGM sensors can cause skin irritation or detach, affecting accuracy, so regular site checks are essential. 120. A patient with a diabetic foot ulcer has a fever. What should the nurse prioritize? Answer: notify the provider and obtain a wound culture. Rationale: fever suggests infection, requiring urgent evaluation and culture to identify pathogens and guide antibiotic therapy. 121. A nurse is mixing NPH and regular insulin. What is the correct order? Answer: draw regular insulin first, then NPH. Rationale: drawing clear regular insulin before cloudy NPH prevents contamination of the regular insulin vial, ensuring accurate dosing. 122. A patient with diabetes asks about preventing vision loss. What should the nurse emphasize? Answer: control glucose and get annual eye exams. Rationale: tight glucose control slows retinopathy and annual exams detect early changes, preventing progression to blindness. 123. A patient with type 2 diabetes reports muscle aches. What should the nurse assess? Answer: electrolyte imbalances or statin use. Rationale: muscle aches may indicate electrolyte issues, e.g., hypokalemia, or statin side effects common in diabetes, requiring evaluation. 124. A nurse is teaching a patient about glucagon kits. Who should be trained to use it? Answer: family members or close contacts. Rationale: glucagon is used for severe hypoglycemia when the patient is unresponsive, so caregivers need training to administer it. 125. A patient with diabetes has a blood glucose of 170 milligrams per deciliter before lunch. What should the nurse do? Answer: administer insulin as prescribed. Rationale: a premeal glucose of 170 milligrams per deciliter is elevated, requiring prescribed insulin, e.g., bolus, to normalize postprandial levels. 126. A nurse is teaching a patient about diabetic kidney disease. What reduces risk? Answer: control blood pressure and glucose. Rationale: hypertension and hyperglycemia damage kidneys. Tight control of both slows nephropathy progression. 127. A patient with type 1 diabetes has diarrhea and a blood glucose of 400 milligrams per deciliter. What should the nurse do? Answer: check ketones and encourage hydration. Rationale: diarrhea and hyperglycemia increase DKA risk. Ketone testing and fluids prevent dehydration and worsening acidosis. 128. A nurse is teaching a patient about insulin injection depth. What is the correct technique? Answer: inject into subcutaneous tissue, not muscle. Rationale: subcutaneous injection ensures proper insulin absorption. Intramuscular injection causes rapid, unpredictable effects. 129. A patient with diabetes reports hand numbness. What should the nurse suspect? Answer: peripheral neuropathy or cardiac tunnel syndrome. Rationale: numbness may indicate diabetic neuropathy or cardiac tunnel, both common in diabetes, requiring further assessment. 130. A patient with hypoglycemia is alert after treatment. What should the nurse provide next? Answer: a snack with protein and carbohydrates. Rationale: a balanced snack after hypoglycemia treatment stabilizes glucose, preventing recurrence until the next meal. 131. A patient with type 2 diabetes is prescribed sitagliptin. What is its mechanism? Answer: increases incretin levels to boost insulin release. Rationale: sitagliptin, a DPP for inhibitor, enhances incretin activity, promoting glucose-dependent insulin secretion and reducing glucagon. 132. A nurse is teaching a patient about glycemic index. What foods should they prioritize? Answer: low glycemic index foods like whole grains. Rationale: low GI foods cause slower glucose rises, improving control and reducing postprandial spikes in diabetes. 133. A patient with diabetes has a blood glucose of 750 milligrams per deciliter and drowsiness. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: drowsiness and extreme hyperglycemia indicate HHS, requiring urgent fluids, insulin, and electrolyte correction. 134. A nurse observes a patient pinching skin during insulin injection. What should the nurse clarify? Answer: pinch only if subcutaneous tissue is thin. Rationale: pinching ensures subcutaneous delivery in lean patients, but is unnecessary in those with adequate fat, risking muscle injection. 135. A patient with diabetes asks about portion control. Why is it important? Answer: it prevents glucose spikes and aids weight management. Rationale: proper portions reduce carbohydrate overload, stabilizing glucose and supporting weight control, key in diabetes. 136. A nurse is caring for a patient with DKA. What fluid is typically ordered? Answer: 0.9% normal saline initially. Rationale: normal saline corrects dehydration in DKA, restoring volume before transitioning to glucose-containing fluids as needed. 137. A patient with type 1 diabetes forgot their morning insulin. What should the nurse monitor for? Answer: hyperglycemia or ketone production. Rationale: missing insulin causes glucose buildup and potential ketogenesis, risking DKA, requiring close monitoring. 138. A nurse is teaching a patient about preventing hypoglycemia at night. What should they do? Answer: check glucose and eat a bedtime snack if low. Rationale: monitoring and a balanced snack prevent nocturnal hypoglycemia, especially if evening glucose is near normal. 139. A patient with diabetes has a fungal rash in their toe web spaces. What should the nurse advise? Answer: keep the area dry and consult a provider. Rationale: fungal infections thrive in moist areas and can worsen in diabetes, requiring antifungal treatment and hygiene. 140. A nurse is reviewing a patient's glucose log showing high evening readings. What should the nurse explore? Answer: evening meal portions or insulin dosing. Rationale: high evening glucose may reflect excessive carbohydrate intake or inadequate insulin, requiring dietary or regimen adjustments. 141. A patient with type 1 diabetes has a blood glucose of 600 milligrams per deciliter and fruity breath. What should the nurse prioritize? Answer: notify the provider and prepare for DKA treatment. Rationale: fruity breath and severe hyperglycemia indicate diabetic ketoacidosis, DKA, requiring urgent insulin, fluids, and provider intervention. 142. A nurse is teaching a patient about insulin glulicine, Apidra. When should it be administered? Answer: within 15 minutes before or after meal. Rationale: glulicine is a rapid-acting insulin with a 10-15-minute onset, timed with meals to control postprandial glucose spikes. 143. A patient with type 2 diabetes has a blood glucose of 58 milligrams per deciliter and is sweaty. What should the nurse do first? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: mild hypoglycemia requires 15 grams of fast-acting carbohydrates, e.g., glucose tablets, to raise glucose, with rechecking after 15 minutes. 144. A patient with diabetic neuropathy reports a new sore on their foot. What should the nurse advise? Answer: avoid weight-bearing and seek medical care. Rationale: neuropathy impairs healing, and sores can worsen rapidly. Offloading pressure and prompt care prevent infection or ulceration. 145. A nurse is preparing insulin detamir and aspart for a patient. How should they be given? Answer: in separate injections. Rationale: detamir, long-acting, and aspart, rapid-acting, cannot be mixed, as mixing alters their pharmacokinetics, affecting glucose control. 146. A patient with diabetes reports headache and a blood glucose of 420 milligrams per deciliter. What should the nurse suspect? Answer: hyperglycemia. Rationale: headache is a symptom of hyperglycemia caused by dehydration and glucose overload, requiring insulin and fluid management. 147. A patient with type 2 diabetes on metformin is scheduled for a CT scan with contrast. What should the nurse do? Answer: hold metformin and notify the provider. Rationale: contrast dye can impair renal function, increasing metformin-related lactic acidosis risk, so it's typically held for 48 hours. 148. A patient with diabetes has a blood glucose of 52 milligrams per deciliter and is alert. What is the nurse's priority? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: hypoglycemia in an alert patient requires 15 grams of carbohydrates to raise glucose safely, followed by rechecking. 149. A patient with a diabetic foot ulcer has warmth and pus. What should the nurse do? Answer: notify the provider and prepare for wound assessment. Rationale: warmth and pus indicate infection, requiring urgent evaluation, possible debridement, and antibiotics in diabetic patients. 150. A nurse is teaching a patient about insulin pens. What should they do before injecting? Answer: check the insulin type and prime the pen. Rationale: verifying insulin type prevents errors, and priming ensures accurate dosing by removing air from the needle.